Here's how to use a dry powder inhaler. My name is Dr. Rubin. I'm a board-certified allergy and asthma specialist. This is a really important video because there was a popular inhaler called Flovent that was recently discontinued, so many people have been prescribed a dry powder inhaler that looks like this, also known as a diskus. And so it can be a little bit confusing to use if you've never used it before. Please bookmark this and share this with other people so that more people are aware of how to use something like this. A diskus is an elegant device. If you look at the inside of it, there's many gears and different parts to it that take a strip that have packets of tiny amounts of powder and moves it along as you use this device. There is a dose counter. Make sure that it's not at 0 before you use it. If you're getting close to it, make sure you talk with your doctor to get it refilled so that you're not out of medication. Whenever you're using this device, make sure that it is level with the ground when you're holding it, because when you load the medicine and you tilt it, the medicine could fall out. So this is the part where you take your thumb right here and you're going to move it out so that now you have the mouthpiece and a little lever. This has to go so you hear a click like that. That loads the medicine and the medicine counter is going to change at that point. So now I have the mouthpiece by where I'm about to use it, and I'm going to take a deep breath in, blow out, and then from here I'm going to put my mouth over the mouthpiece and tilt it slightly back, and with my head back like this and my back is straight, I will take a deep breath and hold it for about 10 seconds. Then I'm going to close the device, and I would take some glass of water and I would swish and spit the water out to make sure that I get any residual medicine out of my mouth to reduce the chances of thrush. Make sure that you store that inhaler in a dry place and wipe the mouthpiece area with a dry cloth.